Good morning, everyone, and welcome to today's webinar hosted by the Associated Landscape Contractors of Colorado. We apologize about the delay. We had some last-minute information come forward. Thank you again for joining us. I'm John McMahon, CEO of the ALCC. Today's topic, Navigating COVID-19 in Your Colorado Landscape Business, is intended to provide light information to what is a rapidly changing environment. Today we have a panel of ALCC experts presenting various topics that impact our landscape community. This one-hour webinar is intended not only to provide you insights, but also to bring our businesses together, help us be stronger during this difficult time. You know, frankly, candidly, I think all of us would like to be in person having this meeting, and we could probably have this meeting go for 2 hours. But in light of the restrictions, and there are a number of people joining us today, we'll do our best in this format. Let me now turn things over to our moderator and ALCC Education Director, Melissa Emden, to take you through today's presentation.
Hello, everyone, and thank you for joining us today. Just a few housekeeping items as we begin. This webinar is being recorded. All the participants, with the exception of the presenters, are muted. The recording will be available later today. We'll be covering several different topic areas. We'll have the presenters present a couple of high talking points, and then go ahead and open up for questions submitted by the chat function. So if you can review the chat, or you can navigate over to the chat function, it's the little text bubble on the left-hand side of your screen, right-hand side of your screen. Submit your questions there. We'll try to get as many questions as possible, but it's possible that we may not be able to get to all the questions, and we may have questions that are unable to be answered because we just don't know at this point. We will do our best to follow up and get all the questions answered, and post a document with all the questions and answers that were presented in the webinar. Later this week, we'll have that posted to our website, so stay tuned for that. At this point in time, I'm going to go ahead and turn it over to our first presenter, David Curtis with Zach George Landscaping.
Hey, good afternoon, everyone. Thank you again for allowing me the opportunity to speak. First, going to kind of just jump into some safety aspects, some changes that have come about due to the COVID virus. Obviously, kind of blends into HR duties as well, but I'll try to focus specifically on safety preliminary. Obviously, this is an unprecedented time as far as uncertainty goes. So with that does come natural stress, questions. As leaders within our organizations and within the community, I think it's imperative to try to focus on open communication, positivity, being honest if you don't have the answers, as well as just being able to calmly answer questions when they do arise within your organization. So first and foremost, goes without saying, we all just need an overall commitment to safety, whether that's related to COVID-19 or just general operations. I think it's easy to get distracted and focus on things specifically relating to the COVID virus. However, because of the influx and more stress on our healthcare system and our hospitals, I think it's imperative that we continue to maintain our normal SOPs for safety, continue to have safety meetings. That way we are reducing, the chance of having an on-site work accident, because just right now is not a great time to go to urgent care or go to the hospital. So doing our part to have an overall commitment to safety, not only adds to confidence with our employees that we are doing everything in our power to take care of them specifically, but obviously not forgetting the day-to-day safety aspects that we need to keep in mind. So with that, just communicating overall safety as far as more so COVID related, routine office cleanings, particularly in high traffic or common areas. A lot of these things have been repeated throughout social media, throughout meetings that we've had, but just communicating to our employees that we are still committed to that. Personally, we've also initiated a non-contact method for greetings as an opportunity for some fun. As things about the virus have come out since late 2019, early 2020, we've had to adapt as the new information is presented, which really is the best that we can do at this point. So if you see your employees still having handshakes, personal greetings, because obviously some individuals are taking this very seriously, some individuals are still referring to it as the common cold or common influenza. This is something that from a leadership aspect should be communicated across the board, regardless of your personal feelings about the virus. We as an organization need to take every precaution necessary, not only that you're not getting sick, but especially individuals who are in the high risk category, doing your personal part to make sure safety is maintained across the board. So bringing back the finger guns, pointing from a distance, doing the fawns, whatever fun you can have with having greetings, there's an opportunity there. I think the 6-foot distance rule between coworkers has been vastly communicated, but just making sure that if you're still seeing individuals, handshake, high five, fist bump, what have you, that you're nipping that in the bud. Communicating or modifying visitor policies, whether that's individuals dropping off packages for UPS, FedEx, these are things that we need to communicate about and just really try to reduce the amount of traffic that is coming in. With that is also embracing a work from home policy. If you have the policy already in place, making sure that you're reviewing it with your leadership team, coming to a mutual decision, and that way your employees aren't getting 3 different stories at 3 different times. It just adds to the confusion and internal stress. So really having leadership meetings, making sure you're all in agreement before rolling out that policy. Or if you don't have a work from home policy, taking the steps and taking the time to come together, aspects of establishing who can work remotely, who it's really not feasible for, just trying to get as many people out of the office to reduce those in-person interactions can really have a big trickle effect down the road as symptoms display themselves, because it is such a lengthy incubation period. So with establishing work from home options, what days of the week are they working, or is it normal business hours? Is there reduction in hours? Expectations regarding reachability, expectations regarding productivity, how often do you want check-ins? Is anything changing with office expenses? Do they need to get approved and go through more rigorous steps as we're all trying to make sure that we're in a good place financially? Other than that, communicating these policies to your employees, giving them refreshers, whether you do have any paid sick leave or leave policies, what their options look like. I've had a lot of individuals who are just asking, hey, I don't have symptoms, but I'd like to self-isolate. I don't want to do so if it's going to, be a risk to my job. So making sure that you're being flexible with that, as well as communicating openly. We've also started doing staggering our start times to decrease the number of field staff that are in one place at the same time, having individuals do direct reports, going straight to the work site, keeping a 6-foot distance when at all possible, obviously, having meetings outdoors if the weather allows, hanging posters from the CDC, just a visual reminder throughout the office, obviously safety things as far as disinfecting surfaces like doorknobs, tables, desks, handrails, microwaves, any high traffic areas, opening some windows to, basically add more ventilation if you do need to have an in-person meeting, or using video conferencing like we're doing currently. So a lot of information there. We're also asking our employees who have the means to take their temperatures every morning. I've actually been taking my personal temperature every morning since the beginning of February. Anything 100 degrees or over obviously would be a red flag, and those individuals would be asked to stay home. Obviously, it's a case by case. We're not physicians. We don't want to play the role of a physician. So if individuals do have health insurance, having them communicate with their physician as far as if they should stay home, if they've been sick and they want to come back to work, what does that look like? So just an overall obsession about hygiene, really, because it is more so transmitted through liquid droplets from what the CDC has most recently stated, washing hands, trying not to touch your face, reminding employees to do the same. If employees see that you're taking these steps, hey, at noon every day, we go ahead and we wipe down the office, that will reduce some stress. So I did get some questions regarding safety. So I do want to touch on those before moving forward with, more HR related, but just as a recap, obviously making sure our day-to-day safety procedures, if there was not the COVID-19 virus going around, to make sure that we're reducing our influx on the medical system. So I did get a question as far as should we stay no more than 10 individuals on a work site? I think that's a great question. Obviously, it went from no more than 100 people in a gathering to 50 to 10, and some states have even gone lower than that. So doing your best to keep individuals with a 6-foot difference. We've instituted not having more than one individual in a work vehicle when at all possible. We have wet wipes within the work vehicles. That way you can wipe them down. Otherwise, individuals are being asked to drive themselves personally to and from the work site. We've played with the idea of sectoring off work sites. So that way we don't have individuals that are communicating or interacting with a group of 10 or more. Obviously, that depends on the work site. But hey, if you're doing a job and you have a specific task that you've been assigned, you've got one other guy with you or whatever that looks like, making sure that you're not going over and just having normal conversations with other individuals. So that is obviously something that you need to do on a case-by-case basis. Or if individuals are having to share equipment, making sure that you do have the proper PPEs, even if it's just a disinfectant wipe to wipe down after your personal use. Kind of like at the gym, once you're done with the equipment, wipe it down, the next individual can jump on there. Did have another question, what are the necessary clothing we should be using when around job sites and around each other? Obviously, there's a huge need for medical masks, gloves, and other equipment. I think that personally is best saved for individuals in the medical industry. However, if I've got a guy who's coming in, who's got his own personal gloves, making sure that, hey, whatever you want to do, if it makes you feel more comfortable to wear gloves throughout your job, go ahead and do so. I don't believe we would need to personally provide masks or gloves within that nature, as long as everybody is following the 6-foot rule and decreasing their interaction with each other. Not a question, but obviously just another point of emphasis to concentrate on being injury-free as possible due to the influx on our urgent care and hospitals. So the individual that submitted those, thank you for that. How do you deal with 6-foot spacing with crews that typically ride in the same vehicle? That's extremely difficult. I would add as much ventilation to that as possible. If you got to implement, hey, the driver touches the radio for whatever reason, it is spread by touching the same point of contact. So that is difficult to realistically do. If individuals are able to jump on that, great. More so jumping into
direct reporting.
Yeah, so the other aspect is direct reports. So, hey, you get in your own personal vehicle, you drive to the job site, keep 6 foot of difference, you're outside, jump right back into your personal vehicle and head home. We're advising our employees to practice social distancing and social isolation. Obviously, we can't dictate what they do in their personal lives, but I personally asked everybody to, make sure that they're staying home once they are home. Not that there's many places open right now, regardless. So more so from an HR aspect, I would say you're being open in communication with your employees and staying current on the spread of the virus. That's a sticky wicket because it's very easy to go down the rabbit hole with some of these statistics and projections for the next week. I do think it's important to keep your thumb on the pulse. Obviously, if there's any updates that are coming out. Currently, this morning, we're just over 60,000 confirmed cases in the United States. We've had 26 deaths so far today. So numbers like that can be very daunting for individuals. So trying to provide them with vital communication and accurate information about the virus, it can be very hard to ignore the latest and most sensationalized news. And employees are going to be getting their information about the virus from somewhere. Naturally, coworkers are going to realistically discuss the company's response to the pandemic, among one another. So whether that's appreciative or critical with their comments, it's important that employees know where we stand and what we're actively doing to keep them safe, to keep the wheels turning, and ideally continue to work. It's a great time for honest and transparent communication. Obviously, this information is rapidly changing. It'll give your employees some comfort knowing that you're staying up to date with information. That way they are not having to check social media every hour to see if there's an update about a shutdown or a lockdown within their area. So just trying to take on some of that. Obviously, as an HR manager, I take that on personally. So trying to spread information once I know it's accurate and current, utilizing the Center of Disease Control and Prevention, the World Health Organization. Those are the sites that I'm using because it is more accredited, and listening to the science and medical professionals is comforting. Explaining to your employees why you're doing something when updating and communicating policy changes, I think just goes a long way. As far as the routine office cleanings, non-contact methods, 6-foot distant rule, modifying your visitor policy, having your work from home policies, staggering your start times, these small steps and the actionable steps that we're taking right now can severely decrease the spread of the virus, not just in general, but within your organization. So having people work from home who have the resources to will just decrease the likelihood that you're having individuals who are sick. Number one goal is to communicate effectively, be calm, ideally positive. This is, like I said, unprecedented for everyone. So spreading misinformation can be very dangerous. Last thing I really want to say is mental health. Communicating to your employees that you are a resource, somebody that can, you vent to me, what have you, communicate your stresses. Otherwise, individuals will, communicate with each other, and I've seen a lot of people who will feed off of each other, and it just escalates stress levels. So, no, there was a lot of information all across the board there. I don't want to go too far into detail about the specifics with the Family First and FMLA expansions, paid sick leave expansions, because we do have an individual that'll be speaking about that here next. So I look forward to some of your questions.
David, it's John McMahon. I just wanted to address one question that was out there. How are you guys dealing with H-2B requirement that companies provide transportations from the office to jobs?
It's a great question. So specifically about how individuals within the H-2B program, once they are here within Colorado, how those individuals get from their homes to the job sites and back. Was that the question?
Yes.
So really it depends on the resources that you have. We've also been discussing what quarantine looks like, how long that would look like for individuals. Obviously, they're going through airports, going through bus stations, just a public bus in general. Those are very high-risk areas as far as traffic is concerned. So that's something I do not have a confident answer on. It would depend on what your logistics look like at a company-to-company basis. For that, we do have work trucks. Normally, we have guys that'll commute together within one vehicle between a bunch of individuals. So ideally, splitting and staggering up time so individuals can utilize vehicles more than once. Honestly, that's something that I'll have to think a little bit more about myself.
Great, and we'll do some more uncovering to see if we can come up with a clear answer at ALCC.
Great. Thanks so much, David. I'm going to go ahead and turn it over to Audrey Savalt from Barrett Business Services Incorporated. She's going to talk about HR, legal, and FAMLA.
Thank you. Thank you, everybody, for letting me join your call. I am an HR consultant for Barrett Business Services. We're a PEO that provides support to small businesses. And over the last couple of weeks, I have been almost on triage phone alert with my business owners with a lot of worry and lack of real information. So today what I'm going to focus on are two of the top questions I'm hearing from business owners. One being, how does unemployment work? And secondly, how does all those leaves, how do they work? And just to let you know that, the things are shifting as we speak. For example, one unanswered question is all employers with less than 50 employees in scope of this family leave, all these family leaves or sick leaves? And the answer is, as of today, yes, but we're looking for more guidance from Congress. And the second question is, with the new $2 trillion bill that was passed by Congress last night, there's a lot of discussion about unemployment and how it's going to be much richer than what we're seeing through the state. So the questions are, how will the state and federal agencies work together to make that work? As you may already know, the state of Colorado's Department of Labor is overwhelmed with unemployment requests. They're struggling through this. So we're trying to figure out how this is all going to work. And I think, as it has been the last 2 weeks, we're figuring out as we go every day, and things change every day. So let's talk about, first and foremost, unemployment. There are a ton of options out there for folks to take advantage of the services available through the state of Colorado. And so as you're thinking through, if you have to let people go do a work stoppage, you have 4 options to consider. And you want to think about how you're going to retain your folks. If you have benefits, is another consideration. And so let's walk through each thing. First of all, there's something called Work Share, and all these are through the state of Colorado. And that allows you to retain your employees but reduce the numbers that they work. You have to pre-register for this program. It still allows employees to receive unemployment. And as of a couple weeks ago, it also may not impact your SUTA taxes by participating in the Work Share program. I should say that we don't really know how your SUTA taxes will be clear in the months to come, given this just sheer influx of people. So we're going to keep a close check on that too through the state. But Work Share is definitely a viable option for you if you have people reducing hours. You just have to pre-register with the state. Another option, which is ideal for your employees that have benefits that you want to keep on the payroll and that will come back, is furlough. Furlough also allows for unemployment. They're eligible for unemployment, but the employees still get to retain their benefits with you. So if they have accrued but unused PTO and vacation, if they have benefits like medical, dental, all those other benefits, you can keep them employed during furloughing and they still collect unemployment. Layoff job attached is the third option, and that is where you tell employees, I'm laying you off temporarily, but it's job attached, and they'll tell the division this. And the way that works is, I'm laid off, I'm terminated, but the minute you have work, you're going to call me back, so I don't have to go hunt for a job. I don't have to tell the agency I'm hunting for work while I'm unemployed. So it's a lot easier, and I have some clients that have very low-paid workers that they've been trying to retain, and they're very seasonal, and they do use the job attachment. They seem to get employees back that way. It's the cheapest option. Finally, the last option is layoff, pure layoff, where you're just basically terminating your folks. They do qualify for unemployment as well, and there's no promise to bring them back, and if you do, you rehire them. And they also qualify for unemployment. So those are 4 options for you to think about, just pondering on who you want to bring back, how you want to bring them back, when business picks up, things like that. So that's unemployment. Are there any questions so far about that?
The questions would come in the way of the comment section. I don't see any additional ones right now.
Okay. Let's talk about the really fun topic about all the sick leaves. Fortunately, if you're in landscaping, you're not in scope for the Colorado Health Emergency Leave Act that was enacted on March 11th. That's good news because it does mandate that anyone who's out sick has to be provided paid sick leave for up to 4 days. So most of my clients are not dealing with that scenario. The emergency paid sick leave, and there's actually, it's confusing. Source documents are Congress's law that was passed on March 18th. And then there's also Department of Labor drafted a document earlier this week that tried to clarify, and it added some information, but it also made it all the more confusing. So I created a table that says, here are the key facts you need to know about this, but you should look at both of those documents to better understand how this works. But right now, the Emergency Paid Leave Act is every small business has to participate, and that has a very wide spectrum of who would be eligible for it. Employees get 80 hours of paid sick leave at full pay up to $511 a day for 10 days, or up to $5,110. And this would be something that you would pay the employees. And if they would get paid this, and this is as of April 2nd, to just keep this in mind, that none of this is in effect now. Everything kicks in on April 2nd. And this allows then employees to be out if they're unable to work due to what they say federal, state, or local quarantine or isolation due to COVID-19. They may have symptoms themselves of COVID-19. They're caring for someone who may have it. They're caring for kids or anyone who's out of school due to COVID-19. Or they may have what the government says, experience and any other substantially similar conditions specified by the Secretary of Health and Human Services. Haven't seen that document yet. It's supposed to come out. So, and I love how they say the DOL say the effective date is April 1st. This is how things shift. I just love it because everybody else is saying 15 days after. The law says 15 days after the Congress passed it, which was March 18th, which would make April 2nd the date of the effective date. But so that's the first law, and potentially everyone could be obligated to pay this if you're involved in any of those 5 or 6 scenarios. And then you have the Emergency Family and Medical Leave Act, and it has 2 dimensions on it. One is if an employee has to care for his or her child because they're out of school, they have to care for someone who's sick, or they themselves are feeling sick. And again, it ties you back to experiencing substantially similar conditions specified by the U.S. Department of Health and Human Services. And at that point, you would pay them for 2 weeks, 66 2/3 of their pay, with up to $200 a day, or $2,000 in aggregate in 10 days. Then there's another phase of the Emergency Family and Medical Leave Act, which is called the Child Care Credit Act. And this is actually through the Department of Labor document that was published earlier this week, and it's also in the law. And it says an employee who's unable to work due to the need to care for a child whose school is closed or child care provider is unavailable. And those employees would be paid 66 2/3 of their pay, up to $200 a day, up to $10,000 in the aggregate, because it could go on for 10 weeks. So that gives you those laws in a nutshell. The big question that I'm getting from clients is, how will I pay for all these leaves? And the answer is, the government has determined that they will give you a refund through your employer's Social Security fund, and and as of Monday and yesterday, they said they will pay within 2 weeks. So I'm watching that closely to see if that's for sure, given the cash flow concerns people have if they're obligated to pay this. But it's something that you should plan for come April 1st or 2nd, so that you're ready for these scenarios to pop up in your workplace. Last thing I'm going to tell you is that as of a few moments, actually in the last couple of hours, the Department of Labor published a poster that you're all required to post in your workplace. It explains these leaves, the federal leaves, in detail for employees to see. So you'll be obligated to post those fairly soon. And I can send a copy of that to you guys so that you can get it out to your workplaces. So with that, let's see, let me look at some questions here. If they are told to stay home due to high risk, would this cover them? What does high risk mean? Do you mean high risk that they could get the virus or that they potentially believe they have it?
So actually everybody is on mute right now.
Okay, so if they're high risk, it isn't that clear in the law defining that. And I think where you're going to have to go to get the answer is through the document that the Department of Health and Human Services is going to provide to define what high risk looks like. So the answer will be in there. I don't know that high risk would mean that I think I might be sick, therefore I'm not coming in. That's not how many of these rules look at it. They want some kind of verification that you're getting checked by a doctor. But the rules have been shifting and getting looser every day, so it's hard to say at this point what that means. I'm looking at the questions here. Sorry about that. They're moving so fast. To clarify, if a city or state ordinance or county ordinance says high-risk people should stay home and they elect to do so, how does that affect them? Well, that would apply to the first two laws, the Emergency Paid Sick Leave and the Emergency Family and Medical Leave Act, for those 2 week scenarios where that would apply. If the state says you can't, you have to stay home. How do we verify if the employee is ill due to COVID if testing is not available? Great question. And at this point, we do not have a clear answer. I couldn't tell you the answer at this point because we don't have enough testing to tell us whether or not they're sick. What I've told clients to do is if they're not sure, if they think the client might have been, or the employee might have been exposed to COVID-19, they should self-quarantine for 14 days. It's a hard pill to swallow, but that's the safest thing to do. All right, any other questions in text? Any other questions coming to mind? I know there are a lot of them, so I'm ready for, I don't have all the answers at this point, but we're getting through them.
Audrey, here's another question. Who qualifies for the less than 50 employees exemption, and which acts provide this exemption?
All right, so a good question. There is an exception to less than 50, and it's about as, I'll read it to you because it's right in the rule that it says, I'm not going to try and interpret it for you, but there is an less than 50 exemption that talks about substantially, a company might be substantially at risk of continuing to exist if they end up accessing the sick leave. And I really don't know how you notify the government of that. It's called small business exemption. Small businesses with fewer than 50 employees will be eligible for an exemption from the leave requirements relating to school closing or childcare unavailability where the requirements would jeopardize the ability for the business to continue. That exception would apply to the last one, the Emergency Family Medical Leave Act childcare credit. And the exemption would be available on the basis of simple and clear criteria to make it available in circumstances involving jeopardy to the viability of an employer's business as a going concern. The Department of Labor will provide emergency guidance and rulemaking to clearly articulate that standard. So we don't have it yet, but that's the exemption that we are aware of. Good question, Melissa.
One more question before we go ahead and move on in the interest of time here. Can employees who are uninsured report symptoms and qualified for paid sick leave, or do employees need documentation from a medical provider that they have symptoms?
Yeah, they do have to provide some kind of proof they're getting checked through the Emergency Paid Sick Leave Act, the first 80 hours of full pay. However, it's much looser in the Emergency Family and Medical Leave Act. There isn't really a lot of guidance there as to whether or not employees are obligated to go to a doctor. It's so loosely defined that what some experts are interpreting that to mean is anybody could say, if I'm not sure, I should be able to qualify for sick leave. So we're looking for guidance in that area. It sounds somewhat flawed or not enough information to make it realistic. So I think we'll get more definition on that in the days to come.
Thank you so much, Audrey. We'll go ahead and move on. If there's any other questions, please go ahead on this topic. Go ahead and put them in the chat function. We'll see if we can follow up afterwards and get some answers to these questions here. Let's go ahead and move on. Did we talk a little bit about Families First Act and expansion?
Actually, yeah, I saw this slide. Yeah, so this really summarizes what I've been telling you about these different exemptions. I'm just looking at this. So the short-term 2-week paid leave, the longer-term 12-week partially paid FMLA extension. So so they all have different criteria and they all have different methods of paying. The first one is full pay. The last two are 66 2/3 of pay, and you're obligated as the employer to pay that. And then the Department of Labor is going to establish a model notice or guidance. So that must be the poster that we do have that we'll make sure you get. And you're working with, let's see here.
Yeah, let me go ahead and clarify that piece, Audrey. Audrey, it's John. So that part is we are continuing to work our efforts on a national level on the Hill with the National Association of Landscape Professionals and our lobbyists there, and also SBA. So we'll continue that fight.
Great. I think that's all I have, unless there are more questions.
Thanks so much. We'll go ahead and move on to Troy Sebelius with the Buckner Company talking about insurance implications.
Hi, everybody. Can you hear me okay?
Yes.
Yes.
Good, Melissa, we're good to go. Okay, great. All right, good. Well, thank you, everybody. One of the quick things that I'll answer that I just saw, and I replied in the chat room, but somebody was asking about liability issues related to drivers going to and from a job site. Basically, on that type of coverage, just for ongoing purposes as you move forward, you want to make absolutely certain that if your employees are using their own vehicles to go to and from the job site, you want to make sure that your own commercial auto policy has coverage for hired and non-owned auto liability coverage. And that would basically protect your company against potential lawsuits or claims where you're impacted if one of your employees got in an auto accident. So we've been extremely busy, obviously, as everybody else. Questions on the insurance industry and what types of insurance coverages there are for this type of a pandemic. Unfortunately, there's not a lot. Most of the property insurance policies have a very specific exclusion related to virus or bacteria claims. And this is primarily due to the fact that, you know, in the past, we've always had flu issues, you know, might have chicken pox, measles, mumps, or something like that, some sort of an outbreak. Your property insurance policy has never been meant to provide coverage for this type of an event. There's also, for your business income or business interruption coverage to apply, there also has to be physical damage coverage to your property, or, for example, your building. If your building caught on fire, that would clearly be a physical damage type of loss, and that would trigger the business income coverage. With a virus or a bacteria like this, there's no actual your facility or equipment, so that doesn't trigger the property insurance. Also, most policies have a pretty stringent pollution exclusion, and there's also questions on this on how that's going to be tested on whether or not this type of considered a pollutant. My guess is that it probably will. And so the carriers will use this as another exclusion to not provide coverage. I think we'll see this tested a lot moving forward with a lot of lawsuits against the insurance carriers, but the reality of it is if if any of these lawsuits are win in court in favor of the policyholder, this would probably bankrupt the insurance industry. So it's going to be a very, very difficult fight. Every claim is a little bit different, and so there's split concerns on how attorneys look at this. They bring it forward into the court system to try to get tested.
Troy, it's John. Let me just interrupt for a moment. There's been some audio cutting in and out with your audio right now, so if there's anything that you may be able to improve, just want you to be aware of it.
Okay, let me do this. I had it on my speakerphone. Is that better?
Yes, I think it is.
Okay, I'll keep trying this, and then let me know. I got my text box or chat box open, so let me know if you can't hear. Regarding the workers' compensation, there's been lots of questions about work comp and whether or not the employees have coverage for work comp. Generally, this is going to be a very difficult type of coverage to prove that an employee actually caught the virus while at work or from a work-related activity. Typically, in order for it to be considered work comp, it has to be something that an employee would normally be exposed to during their normal job duty functions. For example, black lung disease, or a lot of situations that landscapers deal with is all of the issues related to I can't remember the term now, but cutting stone, if you're doing masonry work and you have to wear the masks for that, that would be something that would be potentially a covered type of work comp claim if they had implications from inhaling the silica dust. This would be a similar situation. It would just be very hard to prove that they actually caught it at work. But if they did, they're still, Pinnacle, for example, is still allowing claims to be reported, but then they would have to be able to show that somehow the employee did catch it at work, and then Pinnacle or the work comp carrier would potentially cover that. Pinnacle has also sent out some information to all of their policyholders indicating that they will pay for testing. The problem is that they're saying if you want to get an employee tested, they have to go to their own medical provider rather than your designated medical provider. This obviously raises an issue if those employees may not have health insurance and they're relying on the work comp. I don't know the question of that. We'd have to we'd have to look at that to see how I'd have to check with Pinnacle to see how they're handling that situation from getting an employee tested. Obviously, the urgent care system and emergency rooms and medical officers are extremely busy, and I'm sure you could probably turn that in and talk to your medical provider to see if they would have your employee allowed to come in and get tested. Is it an OSHA recordable incident? Basically, it could be if it was basically defined as a work-related incident, and it also met the OSHA requirements for being medical treatment beyond first aid. So if the employee was actually sent into the hospital and spent the night in the hospital and lost days from work, then it could potentially be an OSHA recordable incident. We've had lots of questions about how do I reduce my premiums. For any of you that were in the 2008-2009 downturn, obviously we had lots of landscapers that were clients for us that had dealt with this and had lots of work that dried up. There's plenty of different ways to, looking at revising all of your estimated annual payrolls for the next 12 months, your revenues. Those are all items that base your premiums for your insurance. Are there things you could lower your equipment values? Most people don't realize that inland marine coverage is written on an actual cash value basis. So if you have a new skid steer that you purchased 4 years ago and you have it insured at that purchase price, each year that price is going to go down on the value and what the insurance carrier is going to pay you if you have a total loss on that equipment or some type of a loss. So you can lower your values on your equipment, look at raising your deductibles on your vehicles if you can afford that. Some carriers might allow you to put vehicles on hold. Basically, if you have vehicles that you're not going to be using, they might be able to take them off of the policy and then you add them back on. You just have to be super careful that if you're doing that, that you are very diligent about adding that vehicle back on if you're going to have somebody drive it. Because if you take it off and you don't tell your employee about it, you can deal with issues of not having coverage there. Also, a lot of the workers' compensation carriers will allow pay-as-you-go or monthly reporting options. So rather than having equal installments throughout the year, obviously lowering your payrolls is going to, for each class code, is going to make a huge difference. Also, but you could potentially set it up as like a monthly reporting form where every month you just send in your payroll and you pay on what that payroll is for that month. So you can check with your carriers on that. Carriers are also offering a lot of assistance with premium payments right now. They're trying to really be proactive and helpful with their policyholders, where if you have to defer a payment for some reason or another, they could potentially do that. So I don't know. I saw a comment on here from Dana Foley about Colorado Cost Containment Certification. I'm not sure what he's referring to on there. He did mention a healthcare provider. They would have work comp coverage, for example, if you were somebody on the front line dealing with people every day that potentially are exposed and you're additionally exposed to this virus. That's the type of employee that would probably likely have work comp benefits because they're faced with this virus every day. So with that, I'll open up any questions and let everybody move on.
Yeah, Troy, I think the questions that were provided to us, you've answered. If there are additional questions, we'll certainly do our best to try to get back to you all with those answers. And just a quick housekeeping note, we are going to be running over that 1 hour. We certainly understand if anybody has to log off. We will have this presentation and the audio recording available afterwards. But in the interest of time, let me go ahead and turn it back over to Melissa.
Thanks, John. We'll go ahead and turn it over to Jay Hicks from Hicks & Associates to talk about legislative implications. Jay, are you on?
Jay? Okay. One moment, everyone.
Hang on a second here, guys. In the interest of time, we'll go ahead and get Jay, see if we can get Jay's audio working here. Let's move on and talk a little bit about landscape company perspective and communications. Let's start with that. So Ben Fisk, if you're on the line, if you wouldn't mind moving forward with that.
Yeah, guys, good to be with you all today. Can everybody hear me okay?
Yes.
Awesome. I just want to take a little bit of a step back and talk about leadership as we kind of jump in here. And I love this quote from Simon Sinek: leadership is not being in charge. It is about taking care of people in your charge. I think through crises and situations like this, we as business owners have to remember that we are leaders, and we are leaders in our community. It's important that we serve our team. So I just want to talk about that for a little bit here, and talk a little bit about some of the things that we are doing. Part of our core values at Physical Landscapes is to treat our team as family. And in a situation like this, we need to take care of our people. And if somebody is sick, obviously letting them have the time off that they need, but then just all of the different things that we've even already been talking about on this call today. I think we as leaders are called to make decisions during times like these and not go run and hide in a corner. And we may make wrong decisions, and that just means we need to show up to work again tomorrow and make a better decision. So I think leaders in times again like these are called to inspire hope and not to just feed the fear. So as we are leading our organizations through this, I hope that each one of us can inspire that hope, not only in our teams, but also in our community. Then I think we also need to serve our clients during this time. We sent out an email blast to our client list just offering to pick up groceries for anybody that needed that. We had one quick story that I'll share with you. An 80-year-old, or she's past 80 now, she's been a client for a number of years. She took us up on it and was very thankful that we offered to bring her some groceries because she didn't want to go out into the community. So I think we have opportunities to serve our team and our clients during times like these. Then kind of the other piece was just our perspective on how we handle something like this. And I think it's important that we have a balanced perspective. We need to take the proper precautions, certainly, but I think we also need to not buy into the hysteria that we kind of see all over the TV. So I think just a nice balanced perspective is the way to approach something like this and not fall off either side of the road. I think we've already really talked about some of those precautions in the call, so I won't take time to kind of talk through all of those. With the exception of just wiping down our trucks daily. I think this is important, especially if you have different guys driving those vehicles. It's a quick daily task that we've added to our routine to really help stop the spread of any germs, because I've read the coronavirus can stay on surfaces for upwards of 2 weeks. So we're just trying to wipe down door handles, steering wheels, dashes, that kind of stuff, anything that might be getting touched in those trucks on a daily basis. And then lastly, wanted to touch quickly on communication. Communication is key, like several other guys have already mentioned, both client communication and team communication. There are some people who are afraid, and I think addressing that with our team on a daily basis is important, and we've been doing that. We send out either a daily note or a daily video to our team, and that generally comes from me as the owner of Physical Landscapes, and talking about different things, whether it's policies, procedures, leadership, or anything else that we need to communicate out to our team on a daily basis, and also just letting the team know that we are there for them. If they have any issues that arise because of this virus, we are there for them. So just daily team communication there, and then also client communication, and posted a couple links there that you can take a look at later on in terms of our response to the coronavirus, and also our Facebook page. We are trying to communicate on a regular basis, kind of in both of those places to our team. So happy to answer any questions that people have, but that's a little bit about kind of what our perspective and what our take is so far on this ever-changing and really unprecedented event going on right now in our businesses.
Thanks, Ben. We did receive one question in advance regarding contracts with clients. If you're adding any clauses into those about changing the work or anything related to not having the workforce to be able to complete the job on the timeline that it's been set to.
Yeah, it's a fantastic question. And in your contracts, you should have something about that. We already had something in our contract that said, I don't have the language right in front of me, something about labor shortages or labor strikes or that sort of thing. And I did read it, and I think that it would cover a situation like this. So if you guys don't have a clause in your contracts stated to that, and certainly an attorney probably would be better to speak to this than me, but it is something that I think is important for contracts. And I think communication, to kind of the second piece to answer that question, communicate to those clients and let them know if you are having a shortage of labor. And you know, one positive side of all of the issues that are going on is that a very tight labor market may actually loosen up a little bit. And for those of us who have been in the industry the last few years, that's been obviously an incredible pain point, getting enough help. So if the labor market does loosen up a little bit, that actually might be a positive for some of us who are trying to hire seasonal help, and just even as our companies continue to grow and we're looking to fill additional slots.
Thanks so much, Ben. I really appreciate your time. We'll go ahead. In the interest of time, we are kind of running a little bit over at this point. Let's go back to, I think we've fixed our audio issues with Jay. So let's kind of move back in the presentation here and let Jay talk about legislative stuff. Jay, can you hear me?
I can. Can you hear me?
Yes, we can. Thank you so much. Sorry for the audio issue.
Good. Oh, no, it's probably me because I've been on 1,800 phone calls in the last 3 weeks, but, you know, lobbying from a distance is taken. So, quick update, the legislative session has been recessed until Monday. All intensive purposes, it's probably going to be re-recessed for another period of a week to 2 weeks. Some people think, depending on the Supreme Court decision on whether or not they can recess and add the days to the back end of the session, or if the days count, will determine on what gets done in the legislature moving forward. So we're hoping to hear from the Supreme Court, hopefully by the end of the week, on what that constitutional mandate will happen. So with that, could be some very quick movement in bills. I think I've heard that most of the leadership is trying to put a lot of bills on what they call essential list. And since we have only a limited amount of time, the budget and a few other bills may be something that is going to be addressed. I'm trying to stay in tune as much as possible, but from what I know is they will re-recess on Monday. And have at least another week to 2 weeks. Some of it's going to make or mimic a lot of the Denver stay or the other stay orders that everybody has been talking about or issued in the counties and the state level. Right now, the state budget, any bill that looks to have a fiscal note is going to be relooked at. Projections last Monday was that the state is going to lose in the upwards of $800 million in tax revenue due to this. So they are trying to rebudget everything based on last year's budget number. So we will see what that looks like. They are constantly keeping tabs on what that budget looks like and trying to keep it as much real time moving forward so they can make the necessary decisions. Constitutionally, they have to pass the School Finance Act, the state budget. And then there's obviously a lot of bills that are being signed and moving along in the process, but we have heard that things that have potentially more than a $50,000 fiscal note be probably tabled until a later time. And so we will probably have to work on that. Anything that we've been working on probably will be tabled. And then I'll get to our last question. The Supreme Court, obviously the briefs were filed yesterday. The AG Weiser actually made a case that it should be a timeout and it should be added on to the end of the session. The Constitution says we have 120 days to work. They are arguing that this is a health mandate and that this should be added on. This is the first time in all my years of lobbying, and I think most people that have lobbied down at the Capitol even longer than I have never seen anything like this. And so there is a Supreme Court decision going to have to made is whether or not we still only have 120 days. So hurry up, get back to work, and you have only a few days to finish, or they will extend some time onto the calendar when everybody comes back. Whether or not that'll be a full 50 days is going to be questioned. Whether or not it's just going to be back to the essential bills and then adjourn for the session. There is a lot of questions on how that's going to be handled. how is public testimony? There's a lot of people that do not want to come back into groups. They are worried about the scare of having 100 legislators in one building with lobbyists and clients and everything as it was prior. How is that going to be handled? So those are what they're going to be dealing with in the next couple of weeks. I will tell you, I have not had a lack of calls with drafters and or legislators. We're just lobbying from a distance and still working on things. So we'll see what the Supreme Court, some people say it may be as early as Friday that we hear from the Supreme Court and then go from there. Executive orders. So the state has there's been a lot of orders that have been issued. Most generally, we watch for Greenco all the state orders, but kind of as sort of a helpful, we've been trying to track all the local ordinances as much as possible to try to figure out sort of the impact on the industry moving forward. So we have seen a number of them. I worked with Polis's office on a bunch of communication and what we call essential businesses moving forward. As you know, the stay order that Polis issued is more of a reduction in work staff than it is a stay-at-home order. Obviously, I think a lot of mayors and cities are now trying to figure out how to minimize economic impact at the same time, create this awareness and safety and distancing, and still allowing people to work from home because not everybody can work from home. And how does that work? And so I think there's been some concessions and some confusion. If anybody was watching the news the other day when Denver issued their stay-at-home, there was a run on stores and liquor stores and everything else, and it causes a pandemic of even more people just standing in line around a building, and obviously that's not social distancing. So a lot of these ordinances have tried to take into consideration this. What I can tell you generally is most of the executive orders have carved out a lot of the services in which Greenco provides as essential, so businesses can still operate. I think we've had some questions come to me about what happens if a general contractor wants you to still show up and the subcontractor does not want to show up because they want to do it. Well, that's in your contract and there's not much you can do it because obviously if it's been deemed essential, that means they still can go to work and have to do precautionary measures. Obviously, there's still contract of delivery times and whatnot. So I think a lot of people in legal counsel have been looking into how does that work if there's still a time certain in which a project has to be done. So the good part about being an essential business is that you'll still be able to work and still have be able to perform. I think the back end of that is that I think there has been some pushback from subcontractors of not wanting to go to work. And so depending on, but obviously because they're essential, the state and or the local municipalities have given them a waiver saying that they are essential. They just have to practice as best. And I think some of the earlier presentations on the mechanisms to stay clean and, operate distance when you can is still in effect. Most of you know that Boulder, Denver, Teller, Tri-Counties have all issued these executive orders. I think there's a few more coming. Will the state issue a stay order? There is talk that the state may or may not issue a state order. I think they have done, may have left it up to the locals to do what they think is best. I don't know if you're going to get a carte blanche state order at this point in time. I will have to keep ear on the pulse. Currently, Denver has a April 10th. Everybody else has an April 17th stay order. So will we see an up or down tick? All the orders allow for them to be adjusted. So we'll have to stay current on what those stay orders look like. Obviously, legislative matters moving forward. I was just sorry, I was late on the call because we are still working on legislation, i.e. the pesticide preemption bill. I do not think family will go this year based on the probably fiscal cost. Obviously, any bill that has sort of a fiscal cost is going to be relooked at. And so we will probably do our best to just find out which bills are going to probably be elevated, and then we will address those individually through our committee and go from there. But right now, all of it's kind of in flux as of now. Questions?
Jay, it's John. Let me just jump in here a little bit. Did you want to go a little bit further into our discussion and why we have looked at landscaping as essential services, given that most of the language that we're seeing out there with the various, even the Tri-County one, still has similar language to we feel that we maintain our essential service status?
Yeah, so this morning I was working with the commissioners to make sure landscaping and our services were included. Obviously, it's kind of one of those auxiliary services you get with the lobbyists. Not really in my order, but I kind of feel like if you guys shut down, then there's not a real good deal. But for all the orders that we have seen, your industry has been covered, and I think will be continue to cover, because I think what they're using is a similar plate or list, right? So getting into early, which we did with the state, which we did with Denver, which we've done with some of the other industries, will cause everybody to sort of use the same template of existing essential businesses to be excluded out. So as of now, what our determination is, every order that's been issued still allows businesses to go on as usual, with the practicing of distancing when possible.
And Jay, is there an opportunity to get specific language either put into the ordinance or for clarification with those municipalities to
after the fact
specifically call out? Right.
I think there is a small window that you potentially, is there some specific one that you're worried about?
Well, I think specifically for us to be able to clarify landscaping as being essential service. I know we're assuming a lot because of the construction and many of the things that we pointed out on our lab. And I think if you go to our COVID-19 page, many of you can see the letters and justifications that we have for it. But beyond that, is there any strengthening of that?
I think, well, so I think what we can do is we can ask, obviously from the state level, obviously that's a reduction in workforce. There is some called out essential businesses in there. To add landscape language specifically might be a little bit difficult to get it kind of, because now they're going to have to readdress or remodify the order. Now, can it be added as an addendum? Yes. But we'd have to sort of start tracking all these down and going through, and then obviously it's going to be a little bit of a work. But it's not to say no is not the proper answer, but it is definitely one of those gray areas that we can go and address. But for instance, the Tri-County has landscape called out specifically.
It looks like Boulder County has that as well, that landscapers are listed as essential. Just going through the comments here, someone commented that 5280 magazine posted on Instagram this morning that landscaping companies are not exempt. So we just may need to do a little bit more clarification and work, and we'll be working on that.
Right. And I want to thank everyone for keeping their eyes out there. We're trying to stay on top of this as much as possible. Obviously, when we put out information, we're getting it from multiple sources. But if you come across this as you have today, please forward it off to that, and we will follow up and try to have those clarifications. Just a couple other points I want to make. On our COVID-19 website, we have put in various pieces of language and justifications. One of the pieces that we have heard is for an example letter, what can be used not only for workers, but also for law enforcement if they're encountered, for justification about being essential services. And so we'll be issuing some additional templates on our website to help the industry. But if you have a letter that's specific to any of those, we'd love to be able to use that and share it with our members.
Great. Thank you, everyone. We've got a couple more questions. I do want to get to the H-2B information as well, which is at the end of this presentation. So I'm going to move ahead to that. I think the questions that we're getting, we will clarify on our website later today once we kind of comb through and post everything that's relevant. So hang on a second here. John, do you want to move forward and talk about H-2B?
Yeah, quickly, it's still dynamic, but for the most part, what we're hearing about the current 33,000 cap is that the processing has been slow. Obviously, there's been focus in other areas that we heard, for example, the Mexican consulate, that those that were returning worker were able to bypass their interviews and were able to be processed. We did hear that the government did suspend visa processing as of 3/18. I know that also brings up the question about the supplemental visas. As you can imagine, what we're hearing on the Hill is that's obviously been a lower priority, and a rule is expected to be delayed past April, possibly back into the time frame of May if that goes forward. We'll certainly continue to update you as we receive information. We do have efforts with the National Ski Area Association in looking at the current H-2B visas that still have not returned to their countries. And if there is an opportunity, obviously there's another opportunity with Small Business Administration that we are also trying to channel that through and see if we get some clarification and have them relax some of the rules. Unemployment will have an impact on our future H-2B with legislators, as there are still job opportunities as a result. If you haven't seen already, we are working with hospitality right now, the Restaurant Association, and hope to have other links as an opportunity here in Colorado for laid off workers, that there may be job opportunities in the landscape profession. And finally, while we don't have the final status of this, there is the July 22nd Day on the Hill in Washington. We'll see if that goes forward, and if it does, then we'll certainly have to, I would really want to try to drive participation to join us if that in fact goes forward. Some other areas, see if there's any questions at this point. We received word that the consulate in Nogales has been randomly or not apparently reason for dropping previous workers. Some employees are seeing 50% reduction in visas at the border. So we will have to take a look at that and report back to the latest. There will be an additional call today with NALP, and we hope to have a little bit more clarification on that. Seeing that there aren't any other questions, in the interest of time, let me just go ahead and move forward. So as I mentioned before, and as you have seen information on, we do have a COVID-19 web resources. If you go to alcc.com/COVID, you will find additional information as well as our legislative blog. We do compile this from a number of different areas. And of course, we'll be posting the Tri-County stay-at-home order as well. I know there was a question that we'll have to also look for some clarity on, and that will have to do with what it said about essential services based on today's medical officers issuing a stay-at-home directive. So we will look into that further for the Denver Metroplexes. So with that, let me thank you all for attending. The webinar is going to be recorded, and a link will be posted at alcc.com/COVID webpage. I will post responses of any unanswered questions on the webpage as well as best we can. And let us know if there's any additional information that was not covered that you'd like to see in perhaps a future session. I'd like to take this opportunity to thank all of our panelists and helping us navigate during these challenging times. And thank you all for joining us and sending us your feedback. The ALCC will keep you updated as more unfolds. Keep sharing your thoughts to ALCC as we continue to do better together as we work to preserve our landscape, family, and industry. Stay safe, everyone. Good day.